Hi and welcome to this video on the vital substances. My name is James O'Sullivan and I hope that you find this video useful. First, let's talk about blood. Blood is not the same as the Western concept of blood. Chinese blood is slightly different. It's a form of qi. It's a denser and material form of qi. In fact, blood is inseparable from qi itself. Qi infuses life into blood because without qi, blood would be inert. In other words, qi gives life and movement to blood, but blood nourishes the organs that produce qi. Blood and yin qi, that we discovered in our previous lecture, are particularly closely connected and as they flow together in the blood vessels. Blood is mostly derived from gu qi or food qi, which is transformed by the spleen. And blood is a part of yin, as it houses and anchors shen. We'll discuss that a little bit more later. Let's look at the creation of blood. We have the origins of blood, or the creation of blood. They have two cycles. The first cycle is post-heaven qi cycle. And this uses food and liquids which are taken into the spleen and transformed into gu qi, which is then sent upwards towards the lungs, and then the lungs push it towards the heart, where it is transformed into blood. This transformation process requires the assistance of yuan qi, or original qi, which is stored in the kidneys. The second cycle is called the pre-heaven qi cycle, and this uses kidney essence, which produces marrow, and this then generates bone marrow, and which contributes towards the making of blood. So blood has two cycles: a pre-heaven source of blood and a post-heaven source of blood. The functions of blood. The blood nourishes the body. Blood is circulated by the heart, as the heart governs blood. It circulates around the body, carrying nourishment to all of the organs, muscles, tendons, tissues. And qi helps it to do this. The blood also moistens the body. Liver blood in particular moistens the eyes and sinews, the hair and skin, and heart blood moistens the tongue and nourishes the mind, or shen. A major function of the blood is also that it supports the mind, or shen. It houses the mind. It helps to anchor the mind, helping us to have clear thought. Where blood is deficient, the mind may also become uneasy, with symptoms of vague anxiety, slight irritability, uneasiness, and an inability to fall asleep. When we look at the patterns of disharmony related to blood, we can see that a blood deficiency can be due to not enough qi moving the blood, or blood not being produced. Usually these relate to the spleen's inability to move gu qi or food qi for blood production. Excess bleeding can also lead to blood deficiency. The clinical manifestations, or the clinical picture of blood deficiency, may have these symptoms: pale complexion, pallor, pale lips, pale thin, dry tongue, insomnia, dizziness, vertigo, blurring of vision, palpitations, numbness of the hands and feet may also be symptom of blood deficiency. Fatigue. Blood deficiency affects the whole body. The tongue may be pale with a thin coating and, as I said earlier, dry. And the pulse may be thin. The most popular pulse for blood deficiency is a choppy pulse, which we will cover later on in the course. Blood stasis is also a pattern that we see. regarding the blood, and this is if qi is weak or stagnant, then it may fail to move the blood, and this leads to blood stagnation or blood stasis, and this may develop into tumours, or it may also be caused by trauma. Clinical picture of blood stasis will be a sharp pain that's fixed in location. It's worse with pressure. There's a dull complexion, tumours, there may be cysts or swelling in the organs. The tongue may be purple and or with purple spots, and the pulse may be deep, choppy, and it may also be slightly wiry. Heat in the blood is our third pattern dealing with the blood. Usually results from internal heat generated by disharmonies of other organs, usually the liver. Clinical picture would be reckless bleeding. There may be hemorrhages, maybe bleeding in between cycles. There's restlessness, irritability. There may be skin problems. When the patient scratches, for instance, they may bleed. And the tongue may be deep red, and the pulse is rapid. When we look at the relationships between qi and blood, there's a very close relationship. Qi is the yang aspect relative to blood, which is yin in nature. There's a saying, qi is the commander of blood, and blood is the mother of qi. So the two of them are inseparable. Blood nourishes qi, in other words, it gives life and movement to qi. But blood nourishes the organs that produce qi, as I mentioned earlier. Qi is yang compared to blood. Qi and blood are inseparable. There are four aspects to the blood-qi relationship. Number one is qi generates blood. As we've seen earlier on, gu qi is the basis or the foundation for blood. Number two, qi moves blood. Where qi goes, blood follows. Or if qi stagnates, blood congeals. So qi is the motive force for blood. 3, qi holds the blood. It holds the blood in the blood vessels, preventing hemorrhage. Blood also nourishes qi. Qi needs the nourishing qualities of blood, provides a dense material, preventing qi from floating. That's the end of this video. I hope you find it useful, and I'll see you in class. Thank you.